Hi, I'm Dr. Schout at the Spinal and Sports Care Clinic, going to demonstrate our spinal decompression table, but using it for the neck, the cervical spine area. As I mentioned in a prior video, you can have problems with disc herniations in the neck as well as the lower back, which would cause a pinched nerve, kind of a syndrome where the pain may radiate all the way down into any particular part of the fingers. It can radiate into the shoulder blade area. And it could also be accompanied by things like numbness, pins and needles, tingling types of feelings. When we do the screening evaluation, we might lift up on the head very gently and people, oh, that feels so good. It might actually help to alleviate symptoms right on the spot. So we know that that person is probably a good candidate to do cervical decompression therapy. So we're ready to go here on the setup. Everything's pretty comfortable. The neck is guarded here by these two adjustable pads, comfort level for bolsters underneath the legs, and then the upper body is suspended in an angled position here to accommodate the neck. So all we would do is lightly secure the head by these straps, and this just keeps the person from sliding around too much. We just want to kind of secure that, but you're not really strapped in per se. Then we have the ability to adjust these pads to move towards the neck to make it so that it's snug and comfortable. So let me know when it feels like it's a comfortable level for you. Good there? Okay. And this again can be adjusted even on the fly, outward or inward based on the comfort level. Then it's just simply a matter of connecting the cable to provide the pull. And then I've got the numbers all set up. And under the same principles of the spinal decompression of the lower back, the same thing, the numbers will ramp up very gradually. So if we're ready to go, then the process starts. Well, there'll be just a slight amount of pull, then it will stop, slight amount of pull, stop, slight amount of pull, and then it will increase to the maximum amount, where at that point, then we can make adjustments accordingly based on the comfort level of the patient and what's happening. We've got the switch, which is to deactivate the process should there be any problems or something not being right. So that one will rest for you. And then we've got the extra security device, which is a little dinner bell that people can ring if there is any kind of an issue during the process, in which we come running to make sure everything is okay. But most people say that when they're doing this, a lot of people just fall asleep on the table. It's so comfortable, quite frankly. So the pull is very gradual. It's very slow. It's pretty relaxing. And in many cases, they can actually feel a relief of their arm symptoms while they're being pulled. So that's a good confirmation that we're doing the right thing. One other thing that we can do here is we can make a little bit of an adjustment on the angle of the pull of the neck. So in a lot of cases with disc herniations and problems, the problems lie down in the lower area around maybe C5, C6 area. And so we can affect the area more precisely by changing the angle of the pull on the table. And that's where I can do something like this and just lower that piece down just a little bit. And now the gap is wider, the head is more into flexion, and then that way that might change the effects or the benefits of that traction. So I would ask that person at that time, does this feel better? Does this feel worse? Which position do you like? And then we go with that for the duration of the traction. Otherwise, that's pretty much a simple process there, but it works on the same basis as the lumbar decompression. It pulls at the higher amount for 1 minute, a lower amount for 20 seconds, 1 minute, 20 seconds. So it still gets that intermittent kind of attraction feeling rather than the one constant, and that gives us the benefit of a superior edge over just standardized traction. And that's it for spinal decompression.